You know, interesting enough, a patient the other day who was waiting for the mutation analysis asked me, what do I hope she has? And I said ALK. And the reason is these patients are living not years, but decades. And so this is great news for our patients. And the J-ALEX trial was the Japanese Alectinib trial, which came out before the North American or Caucasian Alectinib trial. And at the point that it was presented, it was actually extremely intriguing because the overall survival had not been reached. And now it's been reached. So this year, at this year's ASCO 2019, in the J-ALEX trial, again, a Japanese trial looking at alectinib first line, the progression-free survival by independent review was 34 months. So that's huge. And I think it really just solidifies alectinib being our first-line choice in Canada for our ALK-positive patients. Now, it's a busy market. Brigatinib looks just as good. So we're looking forward to brigatinib coming into this picture. We're looking forward to choices. I think as a Canadian, we always look to choices in the first-line setting. Someone who's used alectinib in many patients, either moving from crizotinib or starting off first line, there is that weight gain issue, myalgia, but I think that's really within the first 4 to 6 months, and then patients sort of settle down and you get used to the side effects, and in fact live with the side effects, and many patients are actually back to work. So I think that's a really strong statement about alectinib really getting our patients back to work. I think the overall survival will be equal. I think that due to crossover, many of these ALK inhibitors work after patients actually progress on one. Lorlatinib is a very strong drug that's used second and third line. The Crown trial is using it first line. I think this is a really interesting time for our ALK patients. And overall survival hitting 5 years is amazing. Certainly the very first patient I had started in December 2011, so she's at 9 years, and that's amazing. We're all looking forward to the Crown data where the strongest drug that hits all the resistant mutations, lorlatinib, is used first line. We're looking forward to seeing that. It'll be hard to judge it just on PFS because it's being compared to the other Pfizer drug called Crizotinib, but we're looking for a strong signal. Do you use your best drugs up front? And that's sort of been a common rule of oncology. I think you do.